Good morning. This video is about the transfer of aneuploid embryos in IVF. And it's based upon a recent report which suggests that these embryos, which are normally considered abnormal, when transferred, have the potential, albeit maybe small, to lead to the birth of healthy children. By way of introduction and as a disclaimer, my name is James Stanger. I have a PhD in embryology, and I've been working in this field as an embryologist for more than 50 years. These videos for my FertAge YouTube channel are an attempt to bridge the gap between information you may need for your fertility treatment and the most recent publications available to your clinic staff. I'm not a medical person, and this information is not medical advice, but it may help you in knowing what questions to ask about your treatment with your doctor, and maybe to help in understanding the advice that you receive. If so, I hope it helps. And finally, in my future videos, this page I'm allocating to supporters of IVF Daily. I'm just starting out, but if you wish to promote your company or clinic or product, then this place may be just the place for you. In supporting FertAge's IVF Daily channel, your support may mean an IVF client becoming an informed IVF client. You can click subscribe or become a sponsor, or just make a donation to help others on their fertility journey. So the article in question has just recently been published in Fertility and Sterility, June 2025, and the article entitled Healthy Euploid Dizygotic Twin Births After the Transfer of Non-Mosaic Aneuploid Embryos. It's a mouthful, published by a group in America, and the address that you can see here will lead you to your article. And the report is basically a case study of a couple who made the informed decision to undergo the transfer of multiple aneuploid embryos, ultimately leading to the birth of healthy dizygotic twin girls. Dizygotic means two independent twins. They're not identical twins. So what is aneuploidy and what it's all this about? Well, every cell in the embryo should have 46 chromosomes, as did every cell in each adult. These embryos that have 46 chromosomes are called euploid and are considered normal. If, however, in the egg or the sperm, there is an error in the number of chromosomes, then all the cells in the embryo will inherit this same incorrect number of chromosomes, and this is called aneuploidy or an abnormal embryo. If chromosome errors occur after fertilization in some of the cells during development, then the embryo will be a mixture of good and bad cells. These embryos are called mosaic and have varying degrees of viability. Some are transferred and some are not. Generally speaking, about 40% of all IVF embryos or euploid embryos are normal, about 40% of IVF embryos are abnormal, and 20% are mosaic or variable in number. So at this point in time, we need to make the statement to say that routine IVF does not test embryos for their genetic quality, only their appearance, and embryos transferred may be normal or not normal, we don't know. Same as at home after intercourse, conception can be all normal and not normal, and it's up to the body to sort this out. PGT-A tested embryos, however, always result in the transfer of euploid embryos and the discarding of aneuploid embryos up until now. So what are we talking about? This is a picture of a blastocyst. This is 5 days after fertilization, and you can see the embryo here is made of 3 layers. This is an acellular layer called the zona pellucida that's designed to keep all the cells, the embryo, together and to protect it. There is an outer layer of cells being biopsied here. This is called the trifectoderm, and that gives rise to the placenta. But there are a few groups of cells held back and protected. These are called the inner cell mass, and these cells give rise to the baby. And as you can see in this image here, there's been a hole made in the zona pellucida, and under vacuum, a number of cells are being sucked out, usually between 3 and 6. These cell lines are broken here, and these cells are then multiplied up and tested for the DNA content, which is meant to be an estimate of what's in there, but in reality is only ever testing what is in the trifectoderm. So the PGT-A test results reflect only the future placenta and not the baby. But however, the incidence of aneuploidy is subject to many other things. The main one, of course, is the age of the female, but also to the male to some extent. Generally speaking, about 30% of young women aged about 30, only about 20 to 30% of those embryos are aneuploidy. This rises to more than 50% when women reach over 40, and over 45, almost all the embryos, up to 90%, are aneuploidy. Up until now, aneuploid embryos were not transferred and were discarded. However, most studies have shown that PGT-A cycles reduces the miscarriage rates by up to 50% and may shorten the time to achieve a pregnancy. So there are lots of good reasons for doing PGT-A. But most studies have shown that putting back all the embryos doesn't give you a high pregnancy rate, but may allow you to fall pregnant a bit sooner. This report, casts a little bit of doubt on whether aneuploid embryos should be discarded. And quoting from the paper, in the current report, the parents of twin girls were highly motivated to transfer their aneuploid embryos rather than discard them, despite understanding the risks and the low likelihood of success for pregnancy and live birth. This is a result of their first attempt where all the embryos were abnormal and discarded. And the authors make the comment that unfortunately this couple's IVF journey is not unique, because patients often end up with only aneuploid embryos after an IVF cycle. Many patients are not given the option to transfer mosaic or aneuploid embryos, and ultimately believe that although they had no choice to discard their embryos. This couple consented to publishing their story to support other families wishing to pursue this option. Okay, so about a quarter of PGT-A cycles do not result in transfer because the test results suggest all the embryos were aneuploidy, were not euploidy. Most couples return for another cycle, and particularly older women are more likely not to have a transfer than young women. This report is not saying this is right or wrong, only that it may not be 100% accurate. In IVF cycles, in non-PGT-A cycles, will transfer the best-looking embryos based on how fast they're developing and their appearance, and the most healthy ones are more likely to be euploid and healthy, but maybe not. You can't tell just by looking at the embryo if it's euploidy or aneuploidy. In non-PGT-A cycles, however, have twice the miscarriage rate as PGT-A cycles. This miscarriage rate is the same as what happens in the general population, so it's nothing abnormal. It's been documented for 20, 30 years that the incidence of miscarriage after IVF is no different to what happens in the background population, but PGT-A cycles have been consistently shown to reduce this miscarriage rate by 50%. It's worthwhile noting that half the miscarriages are due to bad chromosomes, which can be tested by PGT-A, and half due to bad genes, which cannot be tested. So, comparing PGT-A or non-PGT-A cycles, you can make the comment that IVF cycles with no PGT-A testing usually result in a fresh embryo transfer of the best-looking embryos and cryopreservation of any remaining good-looking embryos. PGT-A cycles involving testing the embryo on day 5 of development means that all the embryos are tested on day 5 and then freezing all the biopsied embryos so the material can be tested. Euploid and some mosaic embryos are selectively thawed and transferred in later artificial cycles, and aneuploid embryos are usually discarded. Clients with many embryos should always have some healthy euploid embryos for transfer, and these may have a high chance of pregnancy. However, clients with fewer embryos may or may not have any good ones for transfers. If there are only aneuploid embryos available after testing, these are discarded and there is no transfer. However, word has got out, apparently, of some pregnancies occurring after transfer of aneuploid embryos, and I quote a Times article here that you can read, which suggests that they're not happy with it. So it's not surprising that in a highly volatile world of IVF treatment and fertility management, that there will be a natural response to the study to assume that every case where embryos were discarded was wrong. Legal action appeared to have been started, but you have to say that at the moment there's only been one or maybe two publications and usually case studies suggesting aneuploid embryos may give rise to healthy children. It is conceded that IVF clinics and staff may have pushed PGT-A testing at considerable cost to the client and with many cancelled transfers. no one could really validly transfer an abnormal embryo. As I understand, it's not illegal to transfer aneuploid embryos, but some codes of practice discourage it. It's all about best practice, and this practice is always under review. Logic cannot really explain these results. They do need to be confirmed by further publications and studies, and the fact that 2 live births have been recorded after transfer of aneuploid embryos is really just a first case history. So, in the Times article, the couple talked about their first case where all their embryos were abnormal and they were discarded. Then they came back for a second cycle and their mood changed. So basically, in the first cycle, the couple were quoted as saying that their mood changed when the results came back. The test had determined that each of their 5 embryos were abnormal, meaning their clinic, like many in the industry, refused to use any of them. It was, well, like, better luck next time. These are garbage, essentially. I'm sure the clinic staff would not have said that. I'd be horrified if they did. And the Petersons say this was heartbreaking. But having learned about a clinic at Stanford who are transferring in a research trial aneuploid embryos, they make the comment that newly disillusioned with the PGT-A, the Petersons, who now live in Northern California, enrolled in this trial in 2024. There's a last-ditch effort. A doctor affiliated with the Stanford group began transferring their old embryos. Their first attempt didn't take, but in a shock even to their doctors, Peterson got pregnant on a second transfer using an embryo that PGT-A had flagged as having serious chromosomal abnormality. And you can read the whole article at their website. And they make a disturbing comment, say that how could an embryo that was never supposed to have a fighting chance become someone's beloved son, in this case 2 daughters? What was the Petersons and nearly 700 IVF users, along with plenty of doctors and scientists, would like to know? These patients have banded together to file class action lawsuits against many US providers of PGT-A, including the clinics and the company that provide the genetic testing material. Their legal complaint argues that patients were misled about the accuracy and the utility of PGT-A, cheating them out of time, money, and even dreams of having families, since some people had discarded embryos based on their test results. So, is an aneuploid diagnosis correct? Well, theoretically, aneuploidy is considered to be a mitotic event that occurs in the oocyte maturation and should affect every cell in the embryo. These usually fail to implant or may miscarry depending on which chromosomes are absent or duplicated. But when miscarriage, it always results in considerable grief and loss, cost, and everything. Some may implant, as we know, resulting in children with defined syndromes, and that is a totally different subject. A few case reports of transferred aneuploid embryos leading to live births have been floated around the last 1 or 2 years, but they are very scattered. There may be other explanations, including natural spontaneous pregnancy, lab errors, or maybe limitations in technology. There was one study looking at changing technology where aneuploid embryos using next-generation sequencing, what's called NGS, were diagnosed as aneuploidy, but were later described as normal. We're using newer technology called single nucleotide polymorphism, or SNP array testing. As I understand, I'm happy to be corrected, that NGS was used to assess the aneuploid embryos in this case report, which occurred more than 7 years ago. So these babies are now 7 years old. Because aneuploidy embryos are not usually transferred, however, the authors have made the comment that the true incidence of healthy live births after mosaic and aneuploid transfer is not known. There is a growing argument amongst the embryology community that the birth of healthy children after the transfer of mosaic embryos can occur because aneuploid cells in the inner cell mass, the area that gives rise to the baby, migrate or are left behind, either migrate to the trophectoderm or are left behind, leaving the inner cell mass largely full of healthy cells that only give rise to healthy babies, but the trifectoderm may have been contaminated. This leads to an argument that embryo biopsy may not be reliable in predicting the health of a future child. Although you would argue that if you had a diagnosis of euploidy from the trifectoderm, that it's almost certainly the inner mouse will also be euploid. There is also a view that changing technologies may make diagnosis more accurate than those used previously, and you put an argument in this case. The case contributes to the growing body of evidence that non-mosaic aneuploidy embryos can result in healthy live births. However, the low probability of live births and the risk to maternal and fetal health demonstrate that the importance of genetic testing, mental health evaluations, documented ethics consultation, and shared decision-making in these cases is really important. And so it's wrong to go away from this video thinking that all aneuploid embryos are healthy. They are certainly not. And to have to transfer should require considerable interventions and information giving before they proceed. So in summary, for 50 years, good and bad embryos have been transferred in standard IVF, and the industry studies have shown there is no change in childhood health or well-being. So the health of IVF babies have been studied intensively, as you would expect, and there really has been no adverse outcomes. The testing for aneuploidy sought to fine-tune the embryos transferred to only good embryos, but this has not changed the cumulative pregnancy rate. But it has increased the number of no transfers or cancelled transfers. There has been an implicit assumption that aneuploid embryos will fail to implant, or if they do, give rise to miscarriage or specific childhood issues. This paper has cast doubt on this assumption, but there are risks in jumping headlong into the transfer of aneuploid embryos. The risk includes more miscarriages and maybe more childhood issues. Most of the issues of genetic are related to epigenetic ones that may have a male origin rather than the meiotic ones that give rise to aneuploidy. So a summary to this is something you need to ask your doctor about for more information. However, from my point of view, this publication marks a turning point for IVF staff and clients in how information and decision-making about PGT needs to be upgraded to acknowledge that an aneuploid diagnosis may not render the embryo untransferable. It may also require clinics to review their commitment to PGT-A in favour of routine transfers. It may also require upgrading of information systems to keep track of PGT-A diagnosis of each embryo in cryostorage and for record keeping. It may also require new considerations for counselling to ensure clients are aware of the risks and the rewards. I hope this video has been of value. If so, then leave a comment. And if you like it, tell other people about my YouTube channel. Thank you.